Hi everyone, my name is Rosie. Today I'm privileged to have Dr. Ryan with me, who's going to talk to us about COVID-19 vaccine. Welcome, Dr. Ryan, and please introduce yourself to our viewers today.
Thank you so much, Rose. How are you?
I'm good, and you?
I'm good. My name is Dr. Ryan, and today I'm going to talk to you about the COVID-19 vaccine. Rose, many people are asking why the vaccine, why not other ways? But then I want to answer this as a general practitioner, as a doctor. Why the vaccine? It's because many governments world over have put up measures to try and contain the pandemic, and they are not working. Keeping social distance, putting on your mask, hand hygiene, even staying at home. Initially, people are not going to work just when the pandemic set in. So these are not going to work, and again, we don't have a cure or a treatment against this virus. So many vaccines are being developed or have been developed to try and fight this virus. Just to mention a few, we have the mRNA and DNA vaccines, we have the protein subunit vaccines, vector vaccines, and today I'm going to talk about the inactivated coronavirus vaccine.
Okay.
So what really is this inactivated coronavirus vaccine? It is a vaccine made from a virus very similar to the coronavirus, but then it's not the coronavirus, the real coronavirus that is being incorporated in the vaccine. It is biotechnologically engineered, and it's inactivated, like I said, such that when it's injected into your body, it's going to prompt the body to produce antibodies against the coronavirus. Actually, the vaccine has the ability to fight up to 10 strains of the coronavirus. So this is a vaccine. It's being tried. Most of the the ones that are being developed are already in the phase 3, and we have some that have been already they are being approved for use. Yes.
So that's good, Dr. Ryan. So what is the inclusion or criteria when it comes to taking this vaccine?
I'll talk about the inclusion, both the inclusion and the exclusion criteria, because you have the indications and the contraindications for any for any medicine. So first of all, you have to be healthy. You have not to be having a current active acute illness. You are not supposed to be, if you are female in the reproductive age, you are not supposed to be planning to have to get pregnant in the next 3 months or less than 3 months. And again, you are not supposed to you're not supposed to have participated in the clinical trials, the phase 3 clinical trials of the vaccine itself. Because then it means that it's like you got the vaccine already. When you go to the exclusion, now here is where the big issue is. Someone who has just tested positive for pregnancy at the time of vaccination are not supposed to get the vaccine. A mother who is breastfeeding and their infant is less than 6 months are also not supposed to get the vaccine. Someone having a malignancy, a cancer, and they're on treatment for the same, they're not supposed to get the vaccine. Someone who has gotten a Guillain-Barré syndrome before, either after vaccination or without vaccination, another vaccination, are not supposed to get the vaccine. Again, we have so many other groups that are not supposed to get the vaccine, but I'm just trying to give you the ones that we are someone we have people who have gotten the disease, the coronavirus disease, and have gone to the level of being under oxygen supplementation. When they got the disease, they're also not supposed to get the vaccine. Yes.
That's good, Dr. Ryan. I'm really learning a lot from you today.
Yes.
So any other thing you would like our people to know about this vaccine?
The other thing I'd like our people to know about the vaccine is, this vaccine protects you, boosts your immunity, so that when you get the virus, you don't get sick from the virus. But then it doesn't really prevent you from contracting the virus, which means you can still get the virus and transmit it to the other people in the community. So after getting the vaccine, you're supposed to go and continue taking the precautionary measures, putting on your mask, sanitizing, and doing everything else to protect now the others from getting the virus from you. Again, people who have gone through the clinical trials for the vaccine, the phase 3 are not supposed to get the vaccine because it's presumed that they already got, like it's like they got the vaccine, they already are immune. People who got sick with coronavirus before are also not supposed to, are supposed to go through their doctor to evaluate them on whether they can get vaccinated because some of them develop the immunity against the virus. But all in all, we are still in the middle of a pandemic. We still encourage people to take all the measures, and this virus, we don't know how the pandemic is going to treat us into the future. So we are just waiting for the development, even of the viruses, even of treatment and everything, because we really don't know what tomorrow brings about this pandemic. Yes.
Oh, thank you so much, Dr. Ryan. I've really learned a lot from you today, and I hope our viewers have also learned a lot. I'm really humbled to have you today.
Yes, of course, when you conclude interviews, they are usually concluded with greetings and everything. Right now, we cannot shake our hands. As I leave, I just want to leave you with that word of advice. Continue taking care. If the vaccine comes about, the inactivated vaccine, which is most likely to be used in many parts of the world because of the way it's handled, then we encourage, if you are not in the exclusion criteria, and again, something I forgot, if you get the vaccine, the first dose, and then you react to it, moderate to severe reactions, you're supposed not to take the second dose. And that one, of course, will consult with your healthcare provider on whether you'll take it or not. So I'll just leave you with one word: take care of yourself and protect yourself and the community from the virus.
Thank you so much, and thank you our